So the session today, as we said, is what we worked out was there's quite a few people who had concerns about allergies and specific health conditions. So I'm just going to start off with allergies, because we do have quite a few people who have said that they think they can't have the vaccine because of allergies. But if I ask, you know, either Vasa or Paul, just if you could tell us a little bit about any allergies. Can you have the COVID vaccine if you've got particular allergies, and is there one vaccine that would be better than the other? So if we start off with that.
Vicky, before we answer the question, I really want to reassure everybody that both of us are full-time clinicians, and therefore from our perspective, every doubt or every fear in a person's mind, there's a history for that. We also know for every concern, there's a reason behind it. And we know as GPs, for every question which is asked from us, we always somehow or other find to provide an answer. And I think we really want to conduct this session on that basis, that everything is valid, everything should be thrown at us, because we are here to appease your fears, to answer those questions, and to clear away those doubts. So don't hold anything back, have no fear, just throw it at us. Both of us have been around long enough to be able to deal with it. I really appreciate honest questions, and no question is bad, okay? All questions are permitted. Nothing is prohibited here in this forum. Just go for it, and let's leave this room when we finish with where the mist of misunderstanding, the fog is cleared, where we are able to shine some light into the darkness. The cloud of COVID has to go away, and we are here to make it happen together as one.
And thank you, Vasa. You've also, I should have said to you, please introduce yourselves, because I know you're both GPs, but if you'd just like to share, you know, where you work, and I know you've both been in the area for a period of time, so that's be helpful for people to know. Sorry about that.
Can I remind everybody before I would love to hear your introductions as well. I just want to remind everyone to if you could turn your cameras off, just because we record the session and we want to share it online. If you don't know how to, there's a little icon at the top that looks like a camera, and if you press that, you can turn your camera off. I know there's two people online, Karen and Christiana. Thank you.
Thank you, Jiggy. So you heard my philosophy. Now you hear a little bit about me. I've been a doctor for nearly 30 years. I worked in the low modern area since the mid 1990s. And as Vicky said, I'm a GP. Over to you, Paul.
Thank you very much, Vasa, and thank you, Jiggy and Vicky. So first thing I wanted to say actually is I'm very pleased to be able to join the panel today, because I'm full of admiration for all the work that everybody who's joining this session does. You're incredibly dedicated people, and you've worked incredibly hard day in, day out to protect and support the most vulnerable residents in our society in South West London. So the way I see it, we work together as a team. I'm very pleased to be able to try and support you today, and hopefully answer any questions that you may have about the COVID vaccine. As Vasa said, we subscribe to the same philosophy. It's often said there is no such thing as a stupid question, and there really isn't. This is a completely open forum. You shouldn't feel embarrassed about asking any question you want to ask, and we will answer them all as honestly as we can. And if we can't, we will take the question away and we'll make sure that we can come back to answer it for you. So I'm a GP, like Vasa. I work in Merton across 2 practices there. For the last month and a half, I've been working on the COVID-19 vaccination campaign in care homes in Merton. I've been the lead GP for that programme. And I should say that I've had the vaccine. So I know the vaccine is safe, and I know the vaccine works and is effective. My wife has had the vaccine as well, because she's a frontline healthcare worker and she's pregnant at the moment, but she's had it too. But I completely understand why many people may be cautious, may be anxious. There's an awful lot of information about the vaccine that people can access, and it's very difficult for you to tell the difference between information that's true and information that's not true. So hopefully you can come to this forum and you can hear truthful information from us, and I hope we're able to allay some of your concerns today.
So Vicky, let's answer this question in parts. So let's take this issue about allergy. And I will start off with my answer, and I'll always get young Paul, as I call him, to come and clarify any doubts that I might have created. So to begin with, when we talk about allergies, first of all, we must separate side effects and intolerance from minor allergic reactions to anaphylaxis. So clearly, there is a lot of concern when we take a medication, and that may give us a bit of nausea, a bit of diarrhea, a bit of tummy pain, a bit of headache. That is obviously, from our point of view, it is a side effect. It's an intolerance thing. It is not an allergic reaction by definition. Whereas anaphylaxis is a completely different thing, where you have tongue swelling, difficulty in breathing, you go cold and clammy, and of course, in severe anaphylactic shock, you fall down. But that's not a faint, that's a different story. So we must clearly separate these entities. And when we talk about injections and allergies, we are really talking about, have you had an anaphylactic, a major allergic reaction to any of the ingredients in either of these two vaccines? That is the question we ask. So if someone has an allergic reaction to peanuts, we know there are no peanuts in either of these vaccines. If someone has an allergic reaction to penicillin, we know there is no penicillin in either of the two vaccines. So we are reassured. We take a proper allergic history, and then we are reassured that most people, even with a previous reaction to whatever agent it may be, we check against the ingredient list. And we realize a lot of people who say they're allergic to something and even have had tongue swelling with some ingredient, if it is not in the list of ingredients, which we can share if people want us to share that with, then we know it is safe for them. And that's what happens in the vaccine center. People come, they ask a question, and then it's established that they have not had an anaphylactic reaction to the ingredient. And because most people haven't had this vaccine before, they could not have had an anaphylactic reaction to this particular vaccine because they're coming for their first dose. It's quite easy for us to work out who can get it safely and who can't. Paul, would you like to expand on this, please?
Yeah, I think your distinction between allergy and anaphylaxis is a really important one. Apologies, I've got an echo coming straight back at me. I don't know if you can hear me echo, but I'll carry on.
It's fine.
So the first question to ask yourselves is, have you had anaphylaxis? Not just allergy, but anaphylaxis. And anaphylaxis is the most extreme form of allergy. And if you have anaphylaxis, then shortly after coming into contact with whatever triggers it, you're likely to develop a rash all over your body, not just in one place, but all over your body. Your face may swell, your tongue may swell, your lips may swell. You will likely have difficulty breathing and start wheezing, and you will need to go to hospital. And if that has happened to you and you go to hospital, they will almost certainly, if it's confirmed that this was anaphylaxis, offer you an adrenaline pen, which you will know about and you will need to carry around with you at all times subsequently. If you have never had any anaphylaxis, then you don't need to worry at all in terms of vaccine. That's the first thing. If you have had anaphylaxis, then what matters is what you've had anaphylaxis to. Okay. Now, the only reasons why you actually can't have these vaccines are if you've had anaphylaxis to the vaccine itself, which very few people have because most people are only receiving one dose, or if you've had anaphylaxis to an ingredient in the vaccine itself. Very few people will have had anaphylaxis to either the vaccine or an ingredient in it. Okay. Now, you may then ask, how do I know if I have had anaphylaxis to an ingredient? Well, this is only really relevant to one of the vaccines, and that's the Pfizer vaccine. And there is one ingredient in particular in the Pfizer vaccine called PEG, to which some people have anaphylaxis. Now, if you have had anaphylaxis to more than one drug, or if you have had anaphylaxis which is unexplained and you don't know what it's to, it is possible that you have anaphylaxis to PEG. And therefore, in those circumstances, we recommend you have the Oxford vaccine, which does not contain PEG. And that's it, really, you know, I think. So first question is, do I have allergy or anaphylaxis? If you don't have anaphylaxis, you don't need to worry at all. Okay, if you do have anaphylaxis, think, what do I have anaphylaxis to? If it is anaphylaxis to more than one drug, or you don't know what it's to, then opt for the Oxford vaccine.
Thanks, Paul. I think that's really clear. Thanks, and thanks, Vasa. Just there's someone, I think, following on from that, someone who's put that they have got a severe nut allergy and carry an EpiPen. Is the COVID vaccine safe? Should they be going for the Pfizer or the Oxford?
Yeah. So following on, if you follow the story, nut is not a drug. Okay. So because it is not an allergy to a drug, it is safe to have either vaccine, Pfizer or Oxford.
Thank you. And I can see Vasa's popped his hand up.
And absolutely. If you have a concern, raise it at the vaccine site and they will check it and they will confirm it. There is no nut in either of these two vaccines. You can go for it. And in fact, we can safely say at these vaccine sites, people who have been peanut allergic have come in, have taken the vaccine and have gone off safely, because the proof of the pudding really now that we have been vaccinating for more than a month now, we actually can be absolutely reassuring to say we have done it already. We have given injections to people who are not allergic. We have given this injection to people who have got penicillin allergy. So there's no penicillin in it. So don't be put off by concerns. And you're right to be concerned, because in December, we didn't know enough about it. And I know in some places people were turned away in December if they were penicillin allergic. But now we don't do that anymore. So I'm sorry for that. We have contributed to this misunderstanding as a profession, but that's why we are here today, to own up for it and say that's history. Now on, we are giving it because it's not in the ingredient list. But I really like, Vicky, for the audience to have the freedom now. Any one of you, if you're allergic to something, just ask us. Just use this time to throw the question at us and say, what about fish? Or what about latex? What about anything? Because we can answer those questions.
And we have had one come in advance too, about someone who's has a adverse reaction to antibiotics. So they have had swollen fingers, vomiting, headache and heart palpitations, and they're also intolerant of certain foods. Is there any advice for them?
Absolutely. What antibiotic was it? First question.
They haven't specified that.
Okay, because we have clarification from the manufacturers, and they have told us that there is no antibiotic in it. Now, but we can provide more clarification if you tell us which antibiotic you're worried about.
They have popped in erythromycin, actually.
Absolutely safe to say there is no erythromycin in either of these two vaccines.
Yeah, I think one of the things to clarify again is it's a history of anaphylaxis to multiple drugs, multiple being more than one. So if you've had anaphylaxis to one single drug only, it is safe to have either vaccine. But if you've had anaphylaxis to more than one drug, then there is a possibility that it's not actually the drug that is causing your anaphylaxis. It's this thing called PEG, okay, which also is in the Pfizer vaccine. And that's why if you've had anaphylaxis to more than one drug, we would recommend you have the Oxford vaccine, because the Oxford vaccine does not contain any PEG.
Thank you. And just a question that's come in too is around, can I choose which vaccine I have at the hub? Now, at each of the hubs, they will just be using one particular vaccine. So if you do have a medical reason why you need to have one vaccine over another, we would give you are able to attend a hub that's having, so say if you have got an allergy that would mean you couldn't, to PEG, you couldn't have the Pfizer, then we can direct you to one of the sites that has Oxford. Vasa.
So in real life, say in my practice, I did it last week. There was a particular person, for his anaphylactic reasons, I know that I can't book him into the site which is currently doing Pfizer. So I spoke to my practice vaccine lead and she told me, you know what, put his name on a particular list of people we keep on our practice, because when we know AstraZeneca is available, then we will send him a message quick so that he can book himself in on the day we know Oxford AstraZeneca is available. So the clinicians on the ground, talk to them, talk to your practice. The clinician on the ground will know how you can't go to the site and choose a vaccine, but the clinician on the ground has got information, and they all have lists which they could actually direct the patients according to their awareness of which site has got what, which supply is coming to which site and when.
And Vasa, with this group is with health and social care stuff, we are also sending them the hub locations. So and the Royal Marsden, the Springfield site, the Hawkes Road site in Kingston, and the Teddington Health and Social Care Centre. They are all offering the Oxford vaccine, so staff can access them. Thank you. And we've just had, I think, probably following on from that, some questions come in about the side effects. So what are the side effects of the vaccine? So I think as opposed to having an allergic reaction, are people likely to have side effects, and what do the side effects look like? And are they worse in people who are BAME, or are there specific ones for people from BAME background?
I'll give it a go, and I'll hand the baton to Paul as usual. So the best thing about working in the NHS is, you know what? NHS is full of people from all ethnicities, all cultures, and all historic backgrounds. So basically, talking to the people I work with really helps me inform this answer. So I have spoken to people from various countries of origin, you could say, from the ancestors, and they all have gone and had this COVID vaccine, whether the Pfizer or the AstraZeneca. And when they talk to me, I haven't actually seen any ethnic-based differences in the side effects. When I had mine, I had an achy arm for nothing more than 24 hours. I've had a few more colleagues who would say they had a mild headache for 24 hours. Some of them said they felt a bit chilly for 24 hours. But I have had no one in my staff or in my contact social group saying that there are any symptoms which went on more than a few days. The textbook says symptoms can go up to a week, but I'm not even seeing more than a few days. Aches and pains, bit of headache, bit of fever, ache at the point of the location of the injection seems to be the ones I'm hearing.
Yeah, I would agree with that absolutely, Vasa. I mean, I think the most common side effects from the trials are some discomfort at the injection site, fatigue the following day, and headache. You can also get more generalized muscle aches, some joint aches, and a mild fever. But my experience, and from what I've read, is that these symptoms do not normally persist beyond 48 hours. And all things being told, not everybody experiences them, and two, even if you do experience them, they are nothing compared to the severity of illness that you can experience if you were to contract coronavirus and COVID-19. So that's my experience.
Thank you.
Vicky, answering a question on the chat there on asthma. Again, asthma is a very common problem. Asthma affects different people differently. But once again, the NHS has got a lot of its workforce who are also asthmatic. And therefore, we have experience in this. And we are not hearing any report that someone with asthma suffers any extra side effects or consequences for having had the COVID immunization. So we can reassure you that aggravation of asthma is not something which we are hearing about as a consequence. And we would certainly encourage people with asthma, when they are asked to come for the injection, to not to forego the chance of fear of aggravation of asthma.
Well, I think on the asthma point, I would say it's even more important if you have asthma to make sure that you are vaccinated, because certainly there was early evidence that people with severe asthma were at greater risk of severe illness if they contracted COVID-19. So if you have asthma, it's more important that you are vaccinated compared to patients who or population that does not have asthma.
So a good question, Vicky, on chronic fatigue syndrome, if you may.
Oh, I was just going to say there's a couple more about the side effects, Vasa. I was going to say, because someone has asked what might be the cause of a local infection of redness and swelling around the jab for about 4 days, as no one could advise on this. The individual has not had anaphylaxis and is not on medication, and they're a frontline worker in their early 30s. Yeah, just if there's any feedback on that. And then we've got one other side effect question after that.
Yeah, so whenever someone has a reaction like that, I always offer to see them face to face, because I really like to see this redness, because is the redness a reaction or is it unfortunately an infection? An infection may require antibiotic, a reaction doesn't require antibiotics, and the reaction has got important consequence for the second dose. So I would have liked to have seen it at that time to make a decision between the two. Paul, would you want to elaborate on that?
Yeah, I completely agree. So genuine infection following vaccination really is very, very rare, but it could happen because you're breaking the skin with a needle at the end of the day. So skin's a really important barrier to infection, and as soon as you break that, there's a risk that other germs can get in and cause infection. Very low risk, but we couldn't reassure somebody really without either seeing a picture or looking at it face to face that it's not infection. So that's an important first distinction. The second thing I would say, I think you asked why can you get a localized reaction. So what you are doing with the vaccination is you are stimulating the immune system to respond as if there is an infection and as if there is something invading the body. And the normal response to that would be to increase blood flow to the area, so your blood vessels dilate. More blood flow to the area makes it turn red and makes it swell a little bit. So that's why you can get a localized reaction. The third thing I would say is if you get significant swelling and it's very itchy at the site of injection, it is actually very important that we know about that, because that could represent an allergy. And again, it's going to be very rare, but if people do have a localized allergic reaction to the first dose of the vaccine, they must let their clinicians know, because if you go back for the second vaccine, there is a risk that anaphylaxis could occur, and we would want then to give you the second vaccine dose in a hospital setting.
Thank you. So important that they let their GP know and the vaccination team know for the second dose if they have had the redness.
If you've got a reaction at the site and you're concerned, don't hesitate, contact your GP so they can have a look at it. But please contact them now, because you don't want to wait till the 10th week then to discuss what's going to happen with the second dose. Please go for it now.
Thank you. And one of the leads has said that 8 out of 10 of the staff in her team had terrible side effects, fever, muscle aches and headaches. And she's saying, why is that so common after a vaccine? So I think I'm sorry that 8 out of 10 of their staff had that, because generally we're not seeing that high level of side effects. But actually it is happening because your body is starting an immune response to the provocation. So in a way, that is actually an indication that you are now making your antibodies. It's a bit like your soldiers are lining up. They are ready for war. So it's one of those things which I actually very happy when I had a little bit of reaction, because I knew something was going on in my arm, that the vaccine was doing its job. If I didn't have an ache that evening, I would have been very disappointed personally. So I was happy to wear that badge saying, yeah, there is a provocation. My body is preparing for war, and I was happy. I'm ready for it. Thank you. And I think what was interesting for me, we have care home webinars on a Tuesday. As some of you may probably join us on that one. And we had one care home manager who said, yes, she had lots of her staff all had quite a reaction like that. But then another care home manager said, none of my staff had a reaction at all. So it's obviously very different, isn't it, in different people? But remember, Vicky, in hospital, we have hospital staff who are working on the floor. They get a bleep, come down to the vaccine site. They walk down the stairs, they get the vaccine site, and they don't go home. They go back to the ITU, they go back to the ICU, they go back to coronary care, they go back to wherever they came from to carry on with the shift. And you know what? Hospitals are not telling us that their workforce is reporting sick the next day. So really, to me, this is what I look out for. I don't look out for government leaflets and stuff like that. I look out for what is on the ground. What are my friends and family members working in the NHS telling me? And that's what I'm hearing, that the hospital workforce, having been immunized, hadn't had to take a lot of time off because they had these side effects, but they were generally maximum 2 days, and they were able to manage. So that gives me the reassurance. Yes, there are side effects, but they are not significant and serious, affecting our workforce. Thank you. Paul, can I come back to the fatigue one? I love that fatigue one. We'll let Paul finish, and then we'll go to chronic fatigue.
Somebody just asked, I can't remember if we were clear about the answer. Is there a difference between different ethnic groups in terms of side effects? I agree with Vasa, not as far as I'm aware. Everybody may experience some side effects as we've described, or they may not. In terms of the frequency, from the numbers that I've read, I'm not hugely surprised that on occasion 8 out of 10 people reporting some side effects. That discomfort, the fatigue and the headache, I think is likely to occur in over 50% to greater or lesser degrees. But there's never been any severe long-term side effects reported from any of the trials done, or as far as I'm aware, from any of the vaccines that have been administered thus far.
Thank you, Paul. So yes, so conditions. So yes, Vasa. So someone with chronic fatigue syndrome, can they have the vaccine, and would one be better than the other?
Thank you very much. It's a very important question, especially because chronic fatigue syndrome generally has taken place because of the body's reaction to a previous exposure to a known or unknown virus. Now, we also know with COVID that there is this spectrum called long COVID, which happens if you have symptoms after the virus, 12 weeks after you became positive with it. So my view is, this is a personal view. I always talk to my patients. It's not my view. Ultimately, what counts is your view. So the question you have to ask yourself as a patient is, if you already have one virus which has given you chronic fatigue syndrome, what is the consequence for you if you don't protect yourself from this virus and you end up with long COVID on top of your currently existing chronic fatigue syndrome? Because the consequence of long COVID on existing chronic fatigue syndrome, to me, is hard to contemplate. Then you have to ask, so how will I protect myself? The protection you get is from the vaccine. What can the vaccine do? We know the vaccine can give you side effects for up to a week. Even if it gave you vaccine for few more than a week, it will be still less than the consequence of either getting COVID for your body, because COVID patients who get admitted with COVID, they come out of hospital having lost a good proportion of their muscle mass. They come out more than a few kilograms less than they went in. So then my question to you is that the price of not immunizing is, if it's going to be not for all, but for a reasonable proportion, a COVID illness which causes admission or a COVID illness which causes long COVID, then does the balance favor for you, from your perspective, the way you look at stuff in life? Does it favor immunizing, or does it favor what is like the chance of getting severe disease? And you weigh it up in your own mind and talk to your GP. A lot of the time in my discussions, I'm finding people are saying, you know what, I'll take the vaccine because I can't accept long COVID on top of my current chronic fatigue syndrome. That is the way my patients and I talk about it. There's a question about type 1 diabetes. I deal with it while I am here. Type 1 diabetes is certainly not a reason to avoid the vaccine. In actual fact, I will say diabetes, whether it's type 1 or type 2, is good reason to take the vaccine, because we are finding patients who did not have diabetes, who were what we call pre-diabetic. Those patients, when they get COVID and they go into hospital, when they're coming out of hospital, they're coming out of hospital with diabetes, a disease they never had. They're coming out of the hospital with diabetes. So certainly, if you have diabetes, or even if you have pre-diabetes, please, as far as I'm concerned, the vaccine is for you. The vaccine, pancreas, the part of the body which deals with diabetes, we are seeing is being affected by COVID. So yes, type 1 diabetes, type 2 diabetes, pre-diabetes, there's no reason to fear the vaccine.
Thank you. We had a couple of other questions about particular clinical conditions that have come in. One is saying about that they've read that depression, stress and loneliness can weaken the body's ability to develop an immune response to vaccines. So can people with depression take the vaccine? And also someone who's a hematology patient with a high platelet count, can they take the vaccine?
So yes and yes and yes. Absolutely no reason why anybody with mental health problems should not have the vaccine. And as far as I'm aware, there's absolutely no evidence to show that your immune response would be any lower than somebody without mental health problems. So I'd absolutely encourage you to have the vaccine. Same for high platelets. As far as I'm aware, there's absolutely no reason why you should not have the vaccine.
So it is true. It is true that depression, anxiety, and stress does cause a suppression in the immune system. But we are even giving the COVID vaccine to people who are taking what we call immunosuppressant agents, that these patients are taking drugs the doctors give them to suppress the immune system because of other diseases. We are still giving it to these patients because we know that the body will benefit from the injection. So no harm, there is benefit, so there is no reason to avoid.
Thank you. And one of the pre-questions that came in was, are there any known medications that you cannot be on to receive the vaccine? So I guess any medications that mean you can't have that vaccine.
It depends on the ingredient list. The only prohibition is if that agent is, if you are allergic to that agent and it's on the ingredient list. Otherwise, it doesn't matter. We have given people on warfarin, we have given people on blood thinners, we have given people on people who are on lots of medications, heart medications, lung medications, bowel medications, diabetes, you name it, we are giving it to them. In fact, we actually search for these people. We call them extremely vulnerable people, and we invite them ahead of their, we go on these age-based cohorts. So if you are below the cohort line, but you are extremely vulnerable because of clinical conditions, we invite you in because you're taking medication. So it's a qualification for early vaccination rather than delayed vaccination.
Yeah, there is no medication that stops you from having the COVID vaccine. No medication at all that somebody is taking that would stop them from having the COVID vaccine. The one point I might add is if you are taking very powerful drugs that suppress your immune system for whatever reason, and if these sometimes are administered in hospital at certain schedules, so sometimes they might be given through an injection or through a line through the skin, and they'll hang a bag up and you might go to hospital and have that done every couple of months, every 3 months, for example. It is worth considering the timing of your vaccination because you want to try and time the vaccination at a time when your immune system will be at its strongest rather than at its weakest just after receiving the dose of the immunosuppressant drug. But that's a really specialist case and it's going to apply to very, very few people.
Thank you. And warfarin was another drug that some people were concerned about.
Absolutely no problem. We have immunized lots of people on warfarin. All we ask for is to bring your yellow book when you come, and just want to make sure that you have been recently tested for it. And as long as the control is stable, absolutely no problem. And a lot of the patients nowadays are not on warfarin; they are on something we call DOAC, abixaban, rivaroxaban. The drug ends in a BAN. No problem at all. We don't even ask for a blood test for that. It's all fine. So yeah. The prohibitions are, the key message here is everything is permitted. The prohibitions are very little and they are based on ingredient specific anaphylactic reaction.
Thank you. And I know someone had asked for the ingredients. So I know I've got some people from the COVID vaccine team. If you don't mind just bringing up the link and putting it in the chat, because then people can actually look on the internet at what the ingredients are. We've got quite a specific question come in. Someone who had angioedema for tick-borne encephalitis vaccine in the past, and they have asthma and hay fever. They're on the medicines Rhinoblast, sodium chromalogicate plus inhalers, Ventolin and Clinolmedulite 100. Can I be sure I will not have long-term side effects, or example, autoimmune disease or a reaction?
Okay, so Vasa, you may want to contribute to my answer here. I mean, the first thing I would say is the official guidance states that if you have had anaphylaxis or severe allergy to a known vaccine, you can have either Pfizer or Oxford. However, I would suggest that you discuss it with a clinician. And personally, if it was my patient, if I know that you've had severe allergy to a vaccine in the past, I may be more inclined to suggest you have the Oxford vaccine, just in case it was PEG in that previous vaccine that you had a reaction to. That would be my answer. I think the fact that you have hay fever, that's an allergy, not anaphylaxis. Any of the medicines you're taking, we've just been through, no medicine stops you from having COVID. The interesting bit of that question is known severe allergy to a previous vaccine. And the official guidance at the moment is if you know what the vaccine was, you can have either. But my personal suggestion would be if you've had known anaphylaxis to a previous vaccine, I'd be cautious and I would discuss it with a clinician, and I'd be inclined to suggest as the Oxford's available, go for the Oxford. That's my my advice.
Thank you, Paul. I'm sure all of you know that we clinicians in England are extremely cautious animals we are extremely conservative in our thinking. We are not adventurous. So I will do exactly what Paul will do. I will play for safety, and I will prefer to go exactly as Paul said. What I normally do in real life is, in this type of situation, I invite you in. This type of discussion I can't have on the phone and video and all that modern stuff. For this type of thing, I say, come in, wear a mask, I wear a mask, and we'll sit across the table. I'll print out my leaflets. I got on my desktop the list of ingredients. I got something which our pharmacy team talk about, and I will give you the leaflet, and I will show you, take you down that and show you the ingredients-based discussion, this thing called PEG, which I didn't know much about till COVID came along. It's called polyethylene glycol. I never heard of the stuff, but it is in a few places. So if you have got an unexplained allergy or a known previous vaccine allergy, I always say, okay, it could be this PEG. Why hang around with Pfizer? Let's jump into the Oxford AstraZeneca. And that's exactly what I do.
Thank you, Vasa. Thank you. And we've had someone just wanting to check, because they've had reactions to amoxicillin and metronidazole. Would they be better off having Oxford, or is the Pfizer okay?
Pfizer is okay in my opinion. It is not in the ingredient list, and this ingredients list should be available to everybody. I think we should share it at the beginning of the meeting, because it clearly clears the air for what we should be worrying about.
Thank you. And there's a couple of questions from people who have tested positive. So one that came in advance, someone who had COVID and pneumonia in June and was hospitalised twice. They now have long COVID with problems with shortness of breath, tachycardia and sleep apnea, among other things. They had an antibody test last month and it was positive. Now they're worried that if they have the vaccine, that it will give them the strong side effects of the flu type symptoms, which they said they know will pass, but they really don't want to be ill again. I understand I might not get strong side effects afterwards, but on the other hand, I could. Should I hold off on the vaccine?
Difficult question, difficult situation, and I totally understand where you're coming from, because I've spent some time talking to patients with long COVID, but also sad to say this, I have also a lot of colleagues, some very close to me, who also have had long COVID. So I totally get where this concern is coming from. So the situation for us is that we can't predict how long for you can be certain that your antibodies which you develop from your first attack of COVID is going to stay with you and protect you, because antibody positive is one thing, but is it at a level where it's going to protect you is another discussion. So there comes a point in time that someone with long COVID too has to consider themselves vulnerable to get a second attack. Very rare, but it can happen, and that's the issue here. So it all depends on a discussion between you and your clinician, who is totally aware of what we call your symptom burden, exactly how is long COVID affecting you, and then you have to weigh the pros and cons of, shall we delay it a little bit so that your body gets a bit more stronger and then you get the protection immunization, or do we go for it now? Because if in your area, for instance, COVID prevalence is higher than some other area, then again your risks go up, you see. But also remember that you are traveling to work by bus, so you're it's not as if you are staying at home in totally protected environment. So we have to put the environmental risks, the occupational risk, the individual symptom burden, and then between you and your clinician, you've got to come to a discussion with you, not the clinician, with you taking the ultimate decision whether you want to go for it or delay it a little bit. But long COVID is not a contraindication to get COVID immunization. Yes, Paul.
Yeah, I totally agree, and I'm very sorry to hear that you're still suffering with long COVID, as a number of people sadly are. I think we do not know, quite simply, how long symptoms of COVID can go on for. So it is not a straightforward decision. The bit of information I would want to try to get across is that the reason why we advise, so somebody tests positive for COVID, the guidance advises they don't have the COVID vaccine until 4 weeks has elapsed. The reason why that guidance is there is not because it is dangerous to have the vaccine when you have COVID. It's not. There's no evidence that it is dangerous. It's because if you have the vaccine and you experience side effects, we don't know whether those side effects are actually due to the vaccine or if it's because your COVID infection is progressing and getting worse. And we would never want to miss treating somebody whose COVID infection is getting worse because we just thought it was the vaccine. So that's why there's that typical 4-week window. If you test positive, we say we won't vaccinate you for for 4 weeks. If you've got long COVID, I think the likelihood is that although your symptoms are still there, they're not particularly acute. I don't know in your case, but I would guess that you're probably not getting fevers now, for example, this far out, and your symptoms are probably disabling but fairly stable. Therefore, if you were to have the vaccine and experience typical side effects, it's likely that they really are side effects of the vaccine, and therefore it's not going to be dangerous. We're not going to miss any sudden deterioration for you. But you can see all the things that we have to compute in our head and the discussions we have to have with our patients to allow ultimately the patient to make the fully informed decision as to whether they want to proceed with vaccination or not.
Thank you, Paul. And because there is someone who said they they're 4 weeks post testing positive and they still feel very tired and weak. Are they okay to have the vaccine now?
Yeah, so there's similar sort of question really. If you are still having fever and your condition is fluctuating quite significantly from day to day, then personally I would recommend perhaps holding off until you're a bit more stable. At 4 weeks out, most people are fairly stable, and there is no danger, there is no harm from having the vaccine 4 weeks out. It's just the issue of if you get side effects, do we know whether they're side effects of the vaccine or are they actually deterioration in your COVID condition? And we don't want to miss deterioration in the COVID condition.
Thank you. I just had a few of the sort of pregnancy and fertility questions come in advance, which I'll put to you, and then we can open the floor for other questions. So there was two kind of ones that came in about the concerned about the vaccines and the impact for future pregnancy. Will it affect fertility in the future? And then also someone who had lost a baby 2 weeks ago, which I'm sorry to hear about. Is that a red flag to not have the vaccine? They're planning to start trying again. How long should they wait before they have the vaccine? They're quite eager because they're in their late 30s.
I'm really sorry to hear that. I'm sorry about your loss. And I think it's very important that you ask these questions and receive the answer, not just from Paul and myself, but also from your own GP who has to support you and care for you through life and times at this difficult period for you. Having said that, as I said earlier, if you look at the NHS workforce, it is predominantly female, and therefore we have lived experience of our female colleagues who have taken these vaccines, who are, just like you, are very, very concerned and want to make sure that it doesn't affect their fertility. And we have been able to reassure them. They have been able to look at the data. They have been able to look at what has been said to them by their colleagues and come to the conclusion that taking the vaccine does not affect the fertility or the complications of pregnancies in people. So that's the first thing to lay on the table, that among my healthcare colleagues, predominant number have reassured themselves and they have taken the vaccine. And I can say that to me is really, really reassuring. The second thing to say about the timing, there is no timing from the COVID program to say a miscarriage a week ago or 2 weeks ago is a contraindication. But sometimes life is more than science. Life is more about our feelings and our emotions. And I think we need to respect that, and we need to have more weightage for emotions and feelings than for chemistry and science. So I would, if I was talking to my patient, I would have had a discussion and said, you know what, look after yourself. Let's give it a couple of more weeks for you to get a little bit more stability in your life, in the sense that the moment you're going through a difficult period, why rush in now? This is the discussion I have, an open discussion about based on your mood. And then in the end, life is a compromise. So in the end, most of the time when I have these discussions, people say, you know what, yeah, I'll come back in 2 weeks. And the GP is quite happy about it. They'll keep your name down, and we have lots of lists at the moment. So we put your name on a list to say this person should be contacted in 2 weeks, and then there you are, your chance comes back again. But in the meantime, please look after yourself, because what you don't want is to expose and then get the virus in the 2-week window we have mutually agreed to recover from the current crisis you're going through. I hope that answers the question, because we must remember that we are not machines, we are not mechanical. We are clinicians, and you know what? We are also patients. We also have family members. We also have colleagues. When they fall ill, they ask exactly these questions. These are the very questions our colleagues have been asking us as well, and that's why we're able to give you answers. We don't need to prepare the answers. We have already faced the question before. Yes, Paul.
Yeah, I think I have to add, obviously I'm very sorry to hear about your loss, and the point really I think Vasa's emphasising is that these are personal decisions, and every individual will make the decision themselves as to whether they are vaccinated and when they are vaccinated. And we are here to give you information, and your clinician is there to give you information and also support that you need. So nobody should feel pressured into doing anything or in a time frame that they're not comfortable with. I know that the issue or topic of fertility comes up a lot, and a lot of people are worried about it. I have to say, I can't understand where it has come from or how it has originated, because if you do look purely at the science, there is absolutely no reason why vaccination should affect your fertility in any way whatsoever. And so I'm not even sure how it's arisen, but we can say there's absolutely no reason to believe that this will affect fertility. And in terms of pregnancy, obviously it's understandable that people are worried about pregnancy, but in neither of the vaccines, or none of the vaccines that have now been approved, 3 now in total for use in the UK, there are no live replicating viruses. Okay, there are no live replicating viruses in any of the vaccines that have been approved. Therefore, you cannot get an infection from vaccination. Your unborn child cannot get an infection from vaccination. And history tells us that when vaccines with no live replicating viruses have been used throughout history, they have been safe in pregnancy. So there's no reason to believe the vaccine is not going to be safe. And my wife, as I said at the start, she's a frontline healthcare worker. She is pregnant and she has had the vaccine. And I'm fully happy, she's fully happy that it's safe.
Thank you.
Just a bit of more reassurance. So every year, Vicky, we ask people who are pregnant to kindly come up and have the annual influenza vaccine. So we do have experience in immunizing people who are pregnant with vaccine. So it's not something which we never do. This is something which we actually usually do. And that's important to remember. Going back to the pregnancy, you see, for fertility to be affected, your ovary needs to be affected, or your uterus needs to be affected. So the vaccine doesn't do anything with the ovary or the womb. So that is why we know that it doesn't really go into the areas of the body which are part of the fertility system. And that is why we are able to say, no, there is no basis on which way we can work out, even in the off chance, how it goes into fertility. There has been a lot of misunderstanding about DNA and RNA. And I wonder whether this DNA and RNA issue is the issue which then people then get concerned about, which has got fertility concerns. And I think, Paul, we should also address that. Though there are no questions on that, my concern is pregnancy is a process where our genes get transferred from one generation to the other. And because this mRNA DNA confusion, shall I call it, has come into play, I think we should address the issue and say there's no way this vaccine, which is going to alter your DNA, there's no way it can alter it. It doesn't enter the cells to actually, the RNA can't make DNA, it just can't do it. It's not possible. If I could do it, I'll win the Nobel Prize. But it can't happen, so I will never win the Nobel Prize. So I think you got to be clear about it and say RNA cannot affect the DNA, and therefore there's nothing genetically transferred from one generation to the other. Paul, you're younger than me, and you probably certainly know more genetics and DNA than I do. So do you want to come back on that, please?
Yeah, I think I don't want to overcomplicate the picture, really. I would simply say that these vaccines do not alter DNA. They do not affect your DNA. They contain a related molecule called RNA, but that is different, and they just do not affect your DNA, full stop. And also around the pregnancy issue, some people may be wondering, well, if it's safe, why have we not offered it routinely to all pregnant women in the same way it's being offered to everybody else? And the reason is that when we try things out in trials and we try drugs out in trials, typically it is standard to not include pregnant women. And therefore, we don't have a huge amount of experience of using these vaccines in pregnant women. We are gaining that experience because clearly people are being vaccinated, for example, without knowing they are pregnant. And in some countries around the world, I believe pregnant women are currently being included routinely in the vaccination program. So in time, it is absolutely expected that we will have enough data to be able to say it is definitively safe. But for the time being, we can only say there's no reason to believe it's not safe. And all history tells us is that any vaccines that do not contain live replicating viruses are safe in pregnancy, just like the flu vaccine. There is specific advice around trying to conceive and whether you should have the vaccine when you're trying to conceive or whether you should put off trying to conceive. And the advice and the guidance that's come out says you should not change your plans with respect to trying to conceive. You should have the vaccine when it is your time to, it's safe, and continue trying to conceive just as you normally would.
Thank you, Paul. Thank you.
Vicky, there's a question on South African strain. I think we should address that today.
Sure. Yeah.
Because yes, there's a lot in the news about this strain. At this point in time, all the evidence is telling us that the vaccines which are currently licensed are effective. So we are not changing the vaccination plan based on the South African strain. That's the first one. Second one, there's a question there which is asking about how long do they last. Well, the truth is, studies are continuously being published about the duration of the immunization. We are fairly confident that if you get your 2 boosters, it'll last you a year, but I can't tell you that yet because we don't have year-long evidence to support it. But looking at what happens in our previous experience when you use other vaccines, generally one could appreciate with awareness of immunology and antibody production to say if you get both the boosters for the booster-based vaccines, that should go for 12 months. But that science is still developing, and we'll keep you informed.
And quite a few people on that topic have asked me or said, well, I've got antibodies, therefore why do I need the vaccine? Because I've had COVID, so aren't I protected? And the answer to that is you will be more protected if you have the vaccine. And we know, certainly anecdotally, I know people who have tested positive for COVID twice, who have got it a second time, and the second time they actually suffered worse. So having had COVID and testing positive for COVID antibodies does not mean you cannot get it again, and it does not mean you can't still suffer severe COVID illness. So I would absolutely advise everybody who has had COVID or has antibodies from having COVID to have the vaccine when it is your turn, because it will give you extra better protection.
Thank you, Paul.
Vicky, you must say sorry to Norberto. Norberto has pointed out that we haven't answered the question. I'm really sorry, Norberto, but I think you should talk to your GP because it's a bit complicated, your situation. And I think a GP with full awareness of your case notes and your current situation should be able to give you specific advice, because I think given your previous history, I think that will do justice for you.
Thanks. That's fully you to Mila, isn't it? Thank you. Yeah. And I just wanted to just allow a couple of minutes. I know we're coming right up to the hour. 2 minutes, lots of good questions, isn't there? Just if there's anyone on the phone who has a question who hasn't been able to type into the chat, if you'd like to unmute yourself and ask a question, we've just got a sort of a minute or 2 left.
Vicky, I just wanted to add there. Thank you, Paul and Vasa. As there is a few more questions coming in, I wondered, are you able to stay for 10-15 minutes longer? If you have that capacity at the moment, just to answer some of those extra questions.
Paul, I've got a meeting at 3. Are you able to stay, please?
Yeah, no problem. No problem.
Thank you, Paul. And thanks, everybody. Really enjoyed the session. And Jiggy,
thank you very much, Vasa. It was wonderful.
Jiggy, next time you invite Paul and I, you need more time because both of us know each other and we love to talk.
Of course, absolutely. We'll make it longer next time.
Thank you, Vasa. Thank you so much. And I'll just give a chance for people on the phone. Is there anyone who's on the phone who wanted to unmute and ask a question directly?
Hello,
Sorry.
Hello, I'm Shankari, Dr. Paul. Good afternoon.
Afternoon.
I'm working in a science school. So they book for the COVID test as a group. If I go for that hub, how should I know I'm having only the Oxford or Pfizer, something like that?
Okay, so I think your question is, how do you know which vaccine you're going to have when you arrive at the hub?
Yeah.
And I think that the short answer is you won't necessarily know because it does depend on vaccine supplies. So at various times, the supply to each site is either going to be Pfizer supply or Oxford supply. Both vaccines, as we discussed, are safe. Both vaccines are effective. Both have a very similar side effect profile. So it doesn't really matter whether you have the Pfizer vaccine or you have the Oxford vaccine. You'll obviously be told at the time, and they'll ask you if you're happy to have it. If you think you have any contraindications, such as those which we've discussed, which mean you think that it may be better for you to have the Oxford one rather than the Pfizer one, discuss that with your clinician. And I think Vasa said that all the clinicians will be able to liaise with the hub sites. And if the clinician agrees that, yes, you're somebody who should have Oxford, not Pfizer, they will be able to arrange that for you with the hub site.
And just to add on there that, yes, if you do know that you've got a medical condition and you need to have Oxford or an allergy and you know you need to have the Oxford, just please let us know when you're booking, because there are some of the hospital hubs that are regularly using the Oxford, so we can ensure that you're booked into one of those sites. There was someone else who had a caller on the line.
I'm actually happy to answer Norberto as well in the thread. I don't know if Norberto is still here on the online, but I think you are asking, how can you be sure, Norberto, that you won't have long-term side effects from the vaccine? So nobody at all, as far as I'm aware, out of over 55,000 people who took part in vaccine trials, nobody has experienced any long-term side effects. And these trials started last year. So I'm as confident as I can be that you will not experience long-term side effects from vaccination. I'm not aware of anybody developing an autoimmune condition following vaccination that has been definitively linked to vaccination.
Thank you, Paul. Another query that came in, because quite a few people have residents with autism or clients with autism. So how would the vaccine affect clients with autism in relation to behavioural issues? Yeah,
so that's a good question. And there is no evidence that the vaccine affects behaviour in any group or any population, including patients or people with autistic spectrum disorder. So there's simply no reason to believe that vaccination will affect them. And you always have to weigh up the benefits and risks of having vaccination versus not having vaccination. And if you don't have vaccination, you put yourself at risk of developing COVID-19 and suffering severe symptoms and illness with COVID-19. So I would recommend that if you're eligible and you have autistic spectrum disorder, you do get vaccinated. It's the best way to protect yourself from COVID-19.
Thank you. And we did have a question come in. Obviously, there's a bit of change, hasn't there? We were previously going to have the 2 doses 3 weeks apart, and it's now 12 weeks apart to try to give greater coverage of the population. But some concern about, is that still going to be effective, having it 12 weeks later as opposed to 3 weeks?
Yeah, so obviously the government changed their minds on the interval part of the way through the vaccination program, because they realized that they could minimize the impact of coronavirus on the whole population by giving more people one dose rather than fewer people 2 doses. Now, the trials were conducted with a 3-week interval for Pfizer or 4-week interval for Oxford. So some people said, well, the data is not there to support that decision. But again, there's no reason to believe that your immunity from the first dose will suddenly disappear after 3 or 4 weeks. And we're generating more and more data all the time. And I think I was only reading today some evidence suggesting that with the vaccines, immunity does last up to the 12-week, and it may even be beneficial to have an extended interval, because there's some evidence that suggests that with an extended interval, when you give the second dose, you have an even better immune response then.
There's also a question that's come up. Thank you, Paul. There's also another question that came previously in advance. It's a middle-aged man of Asian ethnicity. My question is, in the year 1990, I had a vaccination of typhoid fever in India. Within 10 or 15 minutes of having it, I had a very bad reaction. So as if my head was going to be blown off. Luckily, my mother was with me and instantly took me to the nearest hospital where I got treated. Now I'm wondering if it's safe for me to take the COVID vaccination.
Yeah, so I think discuss it with your clinician. It sort of falls into the same category as the person who had a tick vaccination and had a reaction to that. The official guidance is, if you have had severe allergy to a known vaccine, in your case this is known, then either Pfizer or Oxford should be okay, but both Vasa and I would prefer to make sure we're absolutely safe, just in case it was PEG in that vaccine. I don't know if it was, I don't know if PEG was in that vaccine, and therefore, because I don't know, personally I would recommend you have the Oxford one.
Thank you.
Thank you, Paul. Just looking back through the questions, there was what is the effectiveness of the vaccine after the first dose?
Yeah, so we know that the Pfizer vaccine at about 3 weeks reduces your risk of contracting coronavirus by about 90%, 89, 90%. And the Oxford vaccine is slightly less, but it's still very effective. I think the stat for the Oxford vaccine is just over 70%, but so both of them will significantly reduce your risk of developing coronavirus.
Thank you.
I'll just share with everybody, Vicky, while you're looking at some more questions. As we know, some people are affected by COVID and they're asymptomatic and they don't have any symptoms at all. Some people have mild symptoms and some people can be affected very badly. And having the COVID vaccine, you may get some symptoms, some side effects from it. But if you are in one of the groups where you're affected very badly, then the side effects of the COVID vaccine are going to be nothing compared to what COVID can do. And if you pass it on to somebody else, again, who is going to be affected quite severely with COVID. And so, yeah, I just wanted to share that with everybody. And I know that you're all doing an absolutely fantastic job. And I wanted to remind everybody about wearing that protection that you do when you're at work and when you're in the outside environment, as what you do when you go to shops and travel on public transport. Wear a mask and wearing those gloves when you need to do those specific procedures, changing your PPE when you need to, and when you're around COVID positive people that you are aware of that they're COVID positive, you can wear a double mask. And if you want to have extra protection, you can even wear a triple mask, however you feel comfortable. But make sure that it's over your nose and under your chin, and keep that social distancing even from your colleagues to make sure that you're as safe as possible.
Thank you. And just another question that had come in was around breastfeeding. Is there saying that they realise there hasn't been no data on breastfeeding mothers, and yeah, if you could give us some information about breastfeeding and the vaccine.
Yeah, no problem. So very similar to pregnancy. So when they do the trials, it is standard to not include pregnant women and breastfeeding women in trials, and that's why they weren't included. But again, because none of the vaccines contain live replicating virus, there's no reason to believe that vaccination will affect your baby if you're breastfeeding at all. And I fully expect that in time, when we get more information and more data, we will be able to say absolutely it is safe. At the moment, we can say there's no reason for us to believe it is not safe, because the vaccine does not contain a live replicating virus. It can't infect you. It can't infect your baby.
Thank you very much. I think I could just see one question I think we haven't answered, and this was someone whose mother is 81. They're a diabetic, they've got angina and suffering with venous ulcers and taking antibiotics, allergic to fish and iodine. Can she take the vaccine on Monday?
I'll need to remember the history, but I don't think there was a history of severe allergy, i.e. anaphylaxis, to more than one drug type. So as long as there is no history of severe allergy, anaphylaxis to more than one drug type, no history of severe allergy anaphylaxis that's unexplained, and no known severe allergy to any of vaccine components, you can have either the Pfizer or the Oxford.
Thank you very much, Paul. And just skimming through the messages, and I think, there's one here. It's a very good question, I think, as we draw to a close. Is it, why has there been so much negative talk regarding people from BME communities? Are BME people more prone to get COVID or have issues with the vaccine? If this is the case, why are there not multiple deaths in the Caribbean and Africa?
Yeah, so unfortunately, for reasons that are not fully explained, we know that people from Black and Asian ethnic minority communities are more at risk if they get COVID of having severe illness and of dying from it. The reasons for that are complex, undoubtedly. We don't know whether it's partly due to genetics in those groups. We don't know whether it's because those groups have more additional diseases such as diabetes, high blood pressure, obesity, and those sorts of things. And these are reasons why when they get coronavirus, they're more sick and more of them die. But unfortunately, that is the picture. And therefore, it is even more important that these groups do take up and do receive the vaccine. You've got to protect yourself if you are at high risk of severe illness or death. There is no reason why those groups should not receive the vaccine. The vaccine works equally as well in all populations, and it has been tested and trialled across many different diverse groups of people and populations and races and ethnicities. So my advice to anybody who is Black or Asian or an ethnic minority is that it's more important for you to get the vaccine. And if you're concerned or you're anxious or you've heard something, you want to check it out, go and talk to your clinician, talk to your GP, join the webinars. I wish I had more time and could be here to help you make your decisions, make informed decisions, all day, every day. The advice and the help is there. Please do use us and use it, because we want you all to be as healthy as possible.
Thank you, Paul. That's great. And I realise we have run over. I know there's a question about taking antibiotics, and that's fine, isn't it? You said there's no issues with that.
Yeah. So there's no drug that people take that means they can't have the vaccine.
And does taking vitamin D help?
I wouldn't expect it to have any effect, positive or negative, on vaccination.
Okay, thank you. Well, thank you. I realise we've kept you 15 minutes over. We're very grateful, Paul. It's been really helpful, really positive feedback in the chat. So thank you very much for joining us today, and thank you to everyone who's joined into the call. I hope it's been really helpful for you, helped to answer some of your questions and given you some solid information to be able to make your decision. We hope to see you at a vaccine clinic, and please feel free to share this information with your colleagues. We do have a couple more webinars. We've got one on Thursday evening at 6:30. So Paul Dr. Paul Riley will be joining us on Thursday. So if you've got colleagues who couldn't come today, or if you think of other questions, you're most welcome to join us on Thursday evening. And then we have another one next Tuesday morning as well, with some doctors who are joining us then. And also every day between 3 and 4, and also between 7 and 8, we've got a dial-in drop-in. So if you've got any questions, it's just you can drop in just for a few minutes. It's not such a, come for 10 minutes or for less. Any questions or queries, please feel free to drop into those. And share, and as I said, share with your colleagues. And thanks, Jiggy, that's great, you've put the information in there. Do share with your colleagues, particularly if you've got colleagues who are feeling a bit nervous and still anxious about it. We've put in there the process. So those of you with care homes, you can just email through to carehome.covidvaccine at swlondon.nhs.uk. Let us know that you would like the vaccine. For those of you working for social care, you should have received a letter of eligibility and the booking links from your employer. If not, you can contact homecare.covidvaccine at swlondon.nhs.uk, which has been put further up in the chat, and we can then direct you through to the site. Thank you very much. Just pop there at the end. There's the emails. But yeah, so hopefully lots of availability at the moment in the system. Health and social care workers are our top priority groups. We do know after the 15th of February they'll start moving into the other priority groups. So I think there'll be a lot more pressure on appointments at that time. So I would say try and get your appointment, this week or next week. Lots of appointments available across the system. Thank you. Well, I'll bring this session to a close. Thank you very much, and thank you too to Sadina Agama, who's a pharmacist. And sorry, Sadina, I should have introduced you at the start. You've been doing a sterling job putting some of the answers. Thank you so much, responding to questions in the chat. It's been really, really helpful too. Thank you so much. Thanks a lot, Sadina, and thank you, Paul.
No problem. Thank you very much, Vicky. Thanks, Jiggy. Thanks, Sadina. Thanks everybody for joining. As I said at the start, I'm full of admiration for all the work that you do day in, day out, caring for our most vulnerable residents. So thank you. It's a pleasure to work with you as a team.